Hi, I'm Joe Ruzick from Synergy Physical Therapy and Wellness. I want to show you a really good stretch for plantar fasciitis and heel pain. You're going to need two things to do this. You're going to need a small towel and preferably a foam block or some other kind of block. All right. Now you may have seen other types of stretches before, kind of your basic stretch like this. Another popular one we see is coming up against a wall and kind of stretching like that. Those are okay. They're basic stretches. You might get that from a personal trainer or even a physical therapist. But I want to show you something that's a little more dynamic. It's actually a soft tissue mobilization technique, a myofascial technique along with a stretch. And it's really much more effective than just your basic stretch. So what we're going to do this stretch is you're going to wind up kneeling down. Okay. Now, one precaution too, don't do this stretch if you've had recent knee surgery. If you have, you need to check with your doctor, your physical therapist to make sure the stretch is appropriate. Other than that, it should be good though. It can help for Achilles tendonitis, plantar fasciitis, heel pain, even up here in the IT band. If you're a runner and you have issues with that, it's a good stretch. So what you're going to do, take a small towel like this. You're going to actually put that behind your knee. Okay. Then from there, it's kind of helpful to lean on if you have one of these. What you're going to do is you're just going to kind of come back on that towel, okay? If it's not strong enough, you can make that towel thicker by rolling it up, putting it back in, coming back like this. What you really are shooting for is leaning back hard enough to feel a good stretch, a good amount of pressure, and also notice here, my feet are pointed down. Okay, you really want those feet flat. You want to kind of sit back on your heels if you can. You're really trying to get that ankle to essentially come up, we would say. And when you do that, you should feel a pretty good stretch, pressure in the calf, even the back of the leg, okay? Let's call it a good hurt. We shouldn't make it painful, but strong is okay. Again, this is a myofascial technique, deep tissue technique, as much as it is a stretch. What you do is say, okay, I've got that part done. Now you can kind of move, go to a lower part, work it again, holding 60 seconds each time, okay? You can essentially work from here all the way down. So that's phase one. I'm going to also give you the more aggressive, more stronger type version of the stretch. What you do here, you don't need your towel anymore. It's nice to have something to put your knee on. Again, yoga block works well, foam block. What you're going to do now is you're going to put your shin basically on that. You're going to cross over with your leg. Same idea. Get that right where that towel would have been, right in that calf. You're going to kind of lean back on that, okay? This is more aggressive because, well, your leg is harder than a rolled up towel, so it doesn't give much. And I don't really have any issues going on right now, but I feel a very deep tissue, aggressive stretch right in my calf. Kind of feels like, I kind of need that. So same idea. You'll work 30 seconds each spot, and you'll kind of move down as you go to cover the whole, the whole calf region. So there you go. Simple but very effective stretch for plantar fasciitis, heel pain, ankle pain, even IT band. If you have questions or concerns, give us a call. We'll help you out. Thanks for listening.